Hi, my name's Siri Burke. I'm the Speech Pathologist at Optimum Health Solutions, and I want to have a bit of a chat about the scope of practice of speech pathology. Some people don't understand all of the broad ranges of areas that speech pathologists work in, so I'm going to give a bit of a summary about the areas that we see clients in. So we could see anybody from a newborn through to someone in old age for all areas of communication and swallowing. We would see people who have difficulty with speech, which encompasses the speech sounds that we make when we talk, and someone who has difficulty with language. That includes receptive language, so understanding the world around us and the language that we hear. And expressive language, the ability to express ourselves and our feelings and the things we really mean to say in an accurate way. We also deal with fluency, which is the word we use to describe stuttering. Someone who might have difficulties with those word repetitions or blocks when they're speaking, and we can help children and adults at different stages of their lives who might stutter all the time or maybe in certain circumstances depending on the environment. We also work with patients who have difficulty with their voice. They might have a croaky sounding voice, a hoarse sounding voice, or maybe they're not able to produce any sounds with their voice at all, and we can work with children or with adults in the voice area. We also look at multimodal communication, which is a language extended beyond just verbal language. So that can include people who might have an intellectual disability or a different kind of disability that impacts their ability to express their language verbally. Finally, speech pathologists work in the area of swallowing and anybody who has a disordered swallow. And again, this can be newborns who are having trouble feeding through to elderly populations who might be having difficulty swallowing post-stroke in tandem with things like dementia or maybe Parkinson's disease. And in between, anyone who's having problems swallowing for any reason, a speech pathologist might work with them to make sure that their swallowing is safe and effective and gives them that whole quality of life as well as that safety aspect. So speech pathologists work in a whole range of areas aside from just speech. We cover all kinds of communication and all kinds of swallowing difficulties, and we can work to help people who are struggling in these areas to find better ways to communicate and more effective ways to swallow. If you have difficulty with your communication or your swallowing, or you know someone who does, it might be a great idea to get in touch with a speech pathologist and see how they are able to help you optimise that communication or swallowing difficulty.